Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to talk about a common and chronic autoimmune skin disorder that affects millions of people worldwide called psoriasis. This article delves into the types, causes, symptoms, and treatments of psoriasis, offering insights into managing the condition and improving quality of life for those affected. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's go to the video. Psoriasis is a long-lasting, inflammatory skin condition that can be uncomfortable and emotionally distressing due to the fast proliferation of skin cells that produce thick, red, scaly patches. This is one of the most prevalent autoimmune disorders, affecting 2 to 3% of the world's population. Though it is believed to be caused by a mix of genetic, immunological, and environmental factors, the precise etiology of psoriasis is still unknown despite its widespread occurrence. The illness affects both men and women equally and can show symptoms at any age, although it usually starts between the ages of 15 and 35. Psoriasis can significantly affect a person's quality of life and is not merely a cosmetic problem. The apparent lesions may cause emotional distress and social humiliation, and the physical symptoms may be quite uncomfortable. Furthermore, there are a number of comorbidities linked to psoriasis, such as psoriatic arthritis, metabolic syndrome, and cardiovascular disease. Mental health issues like anxiety and depression are also associated with psoriasis. This video is to give a thorough understanding of psoriasis by examining its various forms, causes, pathophysiology, diagnosis, available treatments, and effects on people's lives. Understanding psoriasis. There are various ways that psoriasis presents itself, and each has unique traits and symptoms. Types of psoriasis. 1. Plaque psoriasis. This is the most common form, affecting about 80 to 90% of people with psoriasis. It is typified by elevated, red areas coated in plaques, which are deposits of dead skin cells that are silvery white in color. The elbows, knees, scalp, and lower back are common places for these plaques to develop, but they can arise anywhere on the body. 2. Guttate psoriasis. This type typically first manifests in infancy or early adulthood and is characterized by tiny, dot-like lesions. A streptococcal infection, such as strep throat, may cause it. Lesions are typically more widespread and less thick than those seen in plaque psoriasis. 3. Inverse psoriasis. This kind affects the folds of skin around the buttocks, in the groin, and under the breasts. Because it affects certain body parts, it can be more unpleasant. It forms smooth, red sores. 4. Pustular psoriasis. This type of the disease can be limited, usually affecting the hands and feet, or it can affect broader portions of the body. It is characterized by white pustules, which are blisters of non-infectious pus encircled by red skin. 5. Erythrodermic psoriasis. This is a severe, inflammatory form that affects most of the body surface. It can result in sheets of scale loss and a generalized, flaming redness. Because erythrodermic psoriasis can be fatal, prompt medical intervention is necessary. Signs and symptoms. Depending on the type of psoriasis, symptoms might differ greatly from person to person. Typical signs and symptoms include of areas of skin that are red and coated in thick, silvery scales, chapped, dry skin that could bleed, soreness, burning, or itching, ridged or thickened nails, joints that are swollen and stiff, psoriatic arthritis. Psoriasis can range in intensity from a few small patches to massive outbreaks covering significant portions of the body. Causes and risk factors. Environmental factors combined with a genetic predisposition are thought to be the cause of psoriasis. Important elements consist of genetic factors. Psoriasis is far more likely to develop in families with a history of the condition. People with psoriasis have been found to have certain immune system-related genes, which suggests a genetic component. Immune system involvement. Psoriasis is an autoimmune disease in which healthy skin cells are mistakenly attacked by the immune system, which accelerates the cycle of cell formation. White blood cells called T cells are essential to this process because they cause inflammation and a high rate of skin cell turnover. Environmental triggers, infections, skin injuries, such as cuts, scrapes, or sunburns, stress, smoking, and excessive alcohol use are some of the environmental variables that can cause or worsen psoriasis. Certain medications, including lithium, beta blockers, and anti-malarial drugs, can also trigger or exacerbate the condition. Pathophysiology of psoriasis. The primary cause of psoriasis is immune-mediated disease. Important pathways in its pathophysiology include the following. Immune system dysregulation. T-cell hyperactivity in psoriasis leads to skin inflammation. The accelerated growth cycle of skin cells caused by this immune response results in the development of psoriatic plaques. Skin cell turnover. In healthy skin, cells undergo a month-long maturation and shed process. This process takes place in a matter of days in psoriasis, resulting in the accumulation of immature skin cells that eventually form scaly plaques. Inflammatory pathways. Tumor necrosis factor alpha, TNF-alpha, interleukin-17, IL-17, and interleukin-23, IL-23, are cytokines that are essential to the inflammatory process. These cytokines play a crucial role in the development and progression of psoriasis. Many of the more recent biologic medications also target these cytokines. Diagnosis of psoriasis. Psoriasis diagnosis is made using a mix of diagnostic testing and clinical assessment. Clinical evaluation. Psoriasis is usually diagnosed by dermatologists based on the way skin lesions form and spread. Along with obtaining a complete medical history, family history, and possible triggers are also determined. Diagnostic tests. To confirm the diagnosis and rule out other conditions, a skin biopsy may occasionally be carried out. A tiny bit of skin must be removed during the biopsy in order to examine it under a microscope. Differential diagnosis. Psoriasis can be mistaken for other conditions, including lichen planus, eczema, fungal infections, and seborrheic dermatitis. These conditions must be checked out by diagnostic testing and clinical evaluation. Impact on quality of life. Beyond just its outward manifestations, psoriasis can have a major negative influence on a person's quality of life. Physical discomfort. Psoriasis-related itching, pain, and discomfort can make it difficult to go about daily activities, sleep, and feel comfortable in general. Psychological and emotional effects. Psoriasis visibility can cause social stigma, humiliation, and a major negative influence on mental health. This includes low self-esteem, anxiety, and depression. Social and economic implications. Because the illness is persistent, there may be higher medical expenses, missed work, and decreased productivity. Because severe psoriasis is visible and can be debilitating, affected individuals may also experience challenges in their personal and professional lives. Treatment options. Psoriasis cannot be cured. However, there are therapies that can help control symptoms and enhance quality of life. Topical treatments, corticosteroids, vitamin D analogs, calcipotriene, for example, and calcineurin inhibitors, tacrolimus, pimecrolimus, are among the first-line treatments. These treatments are used for mild to moderate psoriasis. To lessen inflammation and slow down the turnover of skin cells, these drugs are given topically to the skin. Phototherapy. This involves exposing the skin to ultraviolet, UV, light under medical supervision. For mild to moderate psoriasis, UVB phototherapy and PUVA therapy, psoralen plus UVA light, are frequently utilized. Phototherapy aids in slowing the proliferation of skin cells that are impacted. Systemic treatments, usually used for moderate to severe psoriasis that does not react to topical therapies or phototherapy. They are oral or injectable drugs that act on the entire body. Frequently used systemic treatments consist of methotrexate, cyclosporin, acitretin, and more recent biologic therapies that target particular immune system components. These include IL-17, secukinumab, ixekizumab, IL-23, guselkumab, risankizumab, and TNF-alpha inhibitors, adalimumab, etanercept, infliximab. Lifestyle and home remedies. Psoriasis symptoms can be managed with lifestyle modifications and home remedies, in addition to medical therapies. Frequent moisturizing helps to prevent scaling and irritation and keeps the skin moisturized. Stress reduction methods can lessen the frequency and intensity of flare-ups. Keeping away from recognized triggers, such smoking and binge drinking, is also essential to controlling the illness. Psoriasis is a chronic, multifaceted illness that has major effects on one's body, mind, and social life. Even though there is no known cure, quality of life can be increased and symptoms can be managed by being aware of the disease, identifying triggers, and following treatment regimens that work. Hope for better therapies and eventually a cure is rooted in ongoing research. Through increasing consciousness and cultivating a healthful society, we may assist individuals impacted by psoriasis in leading more robust and satisfying lives. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.